Good afternoon from the National Service of the Liberia Broadcasting System. Welcome to Newsline, a 30-minute presentation of the most reliable news from Liberia and the rest of the world. Today is Friday, the 15th of December 2023. I am presenting. In headlines, the Chinese ambassador reaffirms his government's commitment to supporting Liberia's education sector. Unity Party seeks new union with collaborating political parties ahead of the House speakership elections. USAID Liberia donates life-saving medical supplies to government of Liberia. And away from home, Nigerian Supreme Court rules that separatists Namdi Kanu be kept in jail. These seven stories, including sports, the weather report, the news in French or Kingdom. First is Oleyeze and the news bulletin.
Chinese ambassador to Liberia has reaffirmed his government's commitment to supporting Liberian educational institutions. Ambassador Yin Chang-woo said this is why his government attaches great importance to educational exchange between Liberia and China. Ambassador Yin believes enhancing the quality of education through support and exchange will strengthen mutual understanding and cooperation.
To continue our educational exchange and support to Liberia.
He spoke Thursday when the Chinese embassy presented 400 bags of rice to four Liberian learning institutions in Monrovia. Institutions that benefited include Bomi Community College, Totman University, Cottington University, and the Monrovia Vocational Training Center. Unity Party Legislative Alliance has begun initiating a merger with CPP to produce the new Speaker of the 55th Legislature. According to our legislative reporter, such discussion and possible merger will be made final next Tuesday. The party representative soon is set to be the preferred candidate to face off CDC lawmaker Financial for the Speaker race. Following an hour-long discussions, Representative Coon said the alliance is necessary to ensure victory for the team comprising him and Representative Musa Ability. Our reporter said despite Musa Ability not supporting the Unity Party in the recent elections, he has been viewed as a point man for the UP and the CPP alliance for the House leadership. United States government through USAID has presented several life-saving equipment valued over $800,000 equipment and medical supplies will strengthen neonatal births and reduce maternal mortality rates in Liberia. Some of the equipment include neonatal mechanic ventilation sets, newborn incubators, and resuscitation tables, among others. According to our reporter, 8 health centers in Margibi, Bong, and Nimba counties are targeted beneficiaries of the USAID project. Meanwhile, benefiting health facilities have hailed USAID for demonstrating its expressed commitment to strengthening the country's health system. They said the donation of the equipment has shifted health outcomes in host and surrounding communities. Meanwhile, United States Agency for International Development (USAID) has recommitted to promoting access to quality health care across Liberia. USAID Mission Director Jane Wright believes a healthy population is essential in the growth and development of the country. Mr. Wright was speaking Thursday in Belifani, Bone County, when USAID handed over medical equipment and supplies to the Bone, Limba, and Margibi County health teams.
The U.S. government continues to be committed to helping Liberia to provide access to quality health care for all Liberians. And that is why we are so pleased to be handing over to the Ministry of Health today various life-saving equipment to improve access to health services for mothers and babies.
Mr. Wright said the equipment and medical applies to the three counties will strengthen neonatal births and reduce maternal mortality rates in Liberia. Under the project, USAID equipped and supported 8 health facilities in Bong, Nimba, and Margibi counties to reduce the high maternal and newborn deaths by 50%. At the same time, Liberia's Chief Medical Officer, Dr. Francis Kete, is cautioning healthcare providers to prioritize the welfare and care of their patients. Dr. Kete said prioritizing patient welfare is fundamental to their well-being and rapid response to prescribed treatment.
We have to prioritize the patient. The patient basically are our customer, and we have to treat them right. If we treat them right, they will always want to come back. But if we don't treat them right, then of course they will not come to the facility. They will start going to blood.
The chief medical officer said the lack of proper care also undermines the health system and allows unattended patients to abandon health facilities. Dr. Kete was speaking Thursday in Belifani, Bond County, when USAID handed over medical equipment and supplies to the health teams of Nimba and Margate counties. He hailed USAID for its expressed interest and commitment to revamping Liberia's health system. And employees of the Liberia Broadcasting System have elected new corps of officers. Those elected are Joseph Sayon, President, Koluba Zeze, Secretary General, and Naomi Francis, Financial Secretary, among others. Mr. Sayon defeated outgoing Vice President of the LDS Workers Union, Rachel Colley, 62 to 48 votes, while Naomi Francis also defeated Stephen Dover, 22 to 24 votes. The Secretary General, Assistant Secretary, and chaplain positions were contested unopposed. The new officials will steer the affairs of the LDS Workers Union for the next 3 years.
Grace Molly is there with the news bulletin. You're listening to Newsline on ELBC Radio. One of the big stories we're following this afternoon: Unity Party seeks new union with collaborating political parties ahead of the House speakership elections.